why are there certain tests that women need to have at a certain or from a certain age in life throughout the rest of their life? What are we looking at? What are we looking for?
So, Michael, one of the things that is important for us to understand is that we need to do certain screening tests, like a pap smear, from the moment that we become sexually active. We have a few sexually transmitted diseases, and the one that I'm specifically referring to is human papillomavirus.
Yes.
The majority of us have been exposed. If you've been sexually active and had any kind of unprotected sex, whether it was intercourse or oral sex with someone with HPV, there's a very high likelihood that you will be infected with this.
Okay.
Now, human papillomavirus, there's a lot of them. Certain types causes vaginal warts or anal warts. Some of them can have a more insidious effect where they lead to changes in mucosal tissue, specifically that of the cervix. Those changes become worse and worse, and eventually that is one of the biggest reasons why we develop something called cervical cancer.
Right, right.
So we use these tests as screening tests. And one of the most important messages that I want to relay today is that if you're sexually active as a woman, this is something that you need to do on a regular basis.
Okay.
This is a woman's feature, but if you're sexually active as a man, one of the leading causes of anal cancer is human papillomavirus, and the incidence of anal cancer is far higher than that of cervical cancer, which is one of our most common cancers.
Right. Now, there are vaccines and things for certain of these conditions that you are screening for. Is that correct? I mean, if you had the vaccine, as we know from current circumstances, vaccines don't always stop you from getting something, but you may have a less severe case of it. These screenings need to be done irrespective.
I would continue with him. Human papillomavirus vaccine came around, Elise, about 10 years ago.
Yes.
And it was initially only for girls. And it's a vaccine, very safe, very effective, that protects against cervical cancer. And it needs to be administered prior to your first sexual encounter. We are now starting to use that routinely for boys as well. So teenagers or young people can consider doing this. It will protect against those type of cancers.
Right. Elise, let's go deeper into the specific screening that we are talking about in terms of today's discussion. What are the most important tests that women need to be getting regularly?
Okay, in our practice what we do is we do the pap smear, and usually the pap smear is for women that still has the uterus in place.
And what are you looking for in that one particularly?
We look for atypical cells.
Right.
Okay, typical cells is normal cells. Atypical cells is when there's changes to certain cells. And then after the after your uterus is removed, called a hysterectomy, and I just need to reiterate, there's different types of hysterectomies that can be done. One we call the total abdominal hysterectomy. It's where they remove the whole uterus but leaves, for instance, the ovaries. And the whole uterus includes the cervix.
Yes.
And then they close off the vagina at the top. The other one that they do is the subtotal hysterectomy, where they leave we call it the cervix stump, and close that off.
Okay.
What is interesting is what we see in our patients is that woman doesn't actually know what type of procedure was done on them.
Interesting.
And then when I do the physical examination, I can see, okay, so they still have a cervix or the cervix is removed.
Okay.
So in the woman that had a total abdominal hysterectomy, we do a Volt smear. Now a Volt is just the vaginal tube, I want to call it the vaginal tube, that's been closed off at the top. Now it's important to do a Volt smear for different reasons. There's no discontinuation between the cervical cells and the vaginal wall. It sort of flows into one another, and when they close off that area, you can't see there's a clear demarcation of this is cervix and this is vagina, and that's why we do a smear at that area where the scar is.
Okay.
just to make sure everything is still okay after the hysterectomy. The reasons why women doesn't know why they get hysterectomies. They just blindly believes the doctor, and which is right. But we, as the sort of treaters of hormonal changes, needs to understand why a certain procedure was done.
Because I suppose you trust the doctor that you're doing the right thing in having the hysterectomy, but you need to understand the details of it for future treatment of anything that might happen.
Exactly.
Okay, so we've got pap smear, volt smear, and then we've got 2 more tests that we need to be considering.
So a simple test in the rooms is the vaginal pH test. What we need to know is that our vaginas are acidic in nature. The pH is acidic. Normal acidic ranges is between 3.5 and 4.5. We all know on the scale that is acidic. And for a simple reason it's acidic is the vagina cleans itself.
Okay.
And it's like peristalsis that move out unwanted things in the vagina. If that is off scale, like more basic or alkaline, then the vagina is prone to infections.
Okay.
But not to say that is always the case. What can happen during our lifetime, the pH of the vagina changes. And with intercourse, unprotected intercourse, semen is more alkaline. So it changes the vagina pH, and then women say, sometimes they're allergic to their husband's semen, or they get honeymoon cystitis. It's that type of, when the pH is off balance, then the vagina is prone to infections.
Interesting, sure.
And women also douche. I mean, they wash out their vaginas because they're so scared of getting infections or the odor or whatever, and that's the worst thing to do for a vagina. You need to keep it as it is and just live with it, and if you're not happy with an odor or discharge, see a healthcare professional.
So again, I suppose that's a process of balance that your body is generating.
Absolutely.
You disrupt it by rinsing out.
Soaps are alkaline in nature. So we sometimes have pH balanced soaps. But if you use a pH balanced soap in an acidic environment, it will elevate the pH closer to a neutral balance. And then there's a disruption in the flora that lives in the vagina.
And what's interesting as well is as we go into menopause, our vaginas tend to be also alkaline. And that is why women has that, we spoke about it previously, low-grade thrush infection that they're not even aware of. So that's the pH test that we do with a little dipstick, quick diagnosis at that moment.
Easy and pain-free. Right, we're just about out of time. So urine test, what are we looking at there?
Simple, clear. We do a urine test to diagnose certain illnesses and also or conditions, and to monitor certain illnesses.
So just to quickly tell the conditions, we can look for diabetes, we can look for kidney dysfunction, liver dysfunction, infection. Those are the big ones that we look for. So
this is not just about your sexual organs. This is a body-wide test that you're looking at always.
Absolutely. It's a phenomenal test and an incredibly important one for us to do.
Fantastic. Mark, Elise, last question of the day is just if people want to find out more from you, I know what you're going to say. Let us know where we can find you.
www.thetclinic.com.
And what Elise was supposed to say, we're also on Facebook.
Oh, yes.
Great stuff, guys. Thank you so much. Great insights once again. So thank you for sharing your knowledge with us.
Thank you.